So what's the skeletal system? It consists of bone and cartilage, and it's divided into two subgroups. We have the axial skeleton here in the yellow, and it consists of the skull, the vertebral column, and the ribs and the sternum. The sternum is the chest bone. Okay, and we have the appendicular skeleton, which consists of the bones of the limbs. So, for example, we have the humerus, we have the radius. We have the radius here, the ulna, the wrist bones or the carpals. We have the metacarpals and the phalanges, which are the fingers. And also the pelvis here, the femur, the tibia, the fibula, the bones of the ankles called the tarsals, the metatarsals, and the phalanges of the feet, or the fingers of the feet. Okay, so bones that hold the upper limbs are called the pectoral girdle, and they consist of two bones. The first one is the clavicle and the scapula. So the clavicle and the scapula together are called the pectoral girdle, and they hold the upper limbs to the trunk of the body. Okay, and below the lower limbs are held by the pectoral girdle, the pelvic girdle, which consists of the pelvis bone, also called the hip bones, which are three individual bones, but together it's called the pelvis or the hip bones. Okay, so let's talk about cartilage. It's an avascular form of connective tissue that consists of collagen and elastic fibers. So it's avascular, that means it has no blood vessels, lymphatics, or nerves. And in weight-bearing areas, that means in areas where the body has to hold a lot of weight, for example, the spine, the cartilage has a lot of collagen. So for example, here, the structures in green, they're called the intervertebral discs. They're between the vertebral bodies, and they're basically fibrocartilage that has a lot of collagen. It can't be stretched, so it gives strength to the cartilage. And then in areas where there's less stress, where there's no weight bearing, for example, the external ear, there's a lot more elastic fibers and less collagen. Okay, so what's the functions of the cartilage? It supports soft tissue like the bones and the tendons. It provides smooth surface for bone articulation. So for example, here you see the femur bone and the tibia bone. Together, they articulate or they join together to form the knee joint. And then the surfaces that actually touch, we call this articular cartilage, which is made up of hyaline cartilage. And we'll talk about the different types of cartilage in the next slides. So another function is they enable development of long bones. And we'll talk about this also in upcoming slides. But during embryonic development, the bones develop in two ways. Endochondral ossification, which is the way long bones develop, and also membranous ossification. And we'll talk about it later as well. Okay, so the types of cartilage include the hyaline cartilage, which is the most common form in the body. It's basically the articular cartilage, so like right here. And there's also another type of cartilage, the elastic cartilage. It has a large number of elastic fibers. For example, in the external ear, it's made up of elastic cartilage. It can stretch. And we also have fibrocartilage, which contains large number of collagen. This gives the cartilage strength and rigidity, so it can handle weight bearing. So it can handle weight bearing. And an example of this is the intervertebral discs, because there's a lot of weight here in the spine. Okay, so let's talk about bones. Bone is basically calcified connective tissue. It contains calcium. It's highly vascular. That means it has a lot of blood vessels and nerves. It consists of mainly three things. So first we have the lamellae, which is basically the bone matrix. It's the extracellular component of the bone. It consists of collagen, calcium, and phosphate. So right here, these concentric circles, and right here, the yellow, the concentric circles, are the lamellae. They're the part of the bone that give the bone the toughness. The toughness of the bone or the hardness of the bone is due to the lamellae. It's made of collagen and calcium and phosphate. The calcium and phosphate, they're called hydroxyapatite. Okay, and the bone also consists of things called lacunae, which are spaces that contain the osteocytes. So right here, these spaces are called the osteocytes, and then here we have the lamellae, which is the extracellular component. So the cellular component are the lacunae or the lacuna for singular, and then the extracellular component, which contains the collagen, calcium, and the phosphate, is the lamellae, and they're the ones that are responsible for giving the bone the toughness and rigidity, and they make the bone mature. And whenever a bone has lamellae, we call this mineralized bone or mature bone. And in the future, you'll learn about diseases where the bone doesn't mineralize, like for example in osteomalacia, and this is due to a lack of lamellae or due to lack of mineralization. And the mineralization is it's a function of the osteoblasts. The osteoblasts make the bone matrix, and we'll talk about this more in the upcoming slide as well. And then another part of the bone is called the Haversian canal. So write the Haversian canal right here. The Haversian canal is in the center, and it has blood vessels and nerves. Okay, so let's talk about cells of the bone. So first we have osteogenic cells, which are stem cells. Stem cells are basically undifferentiated cells, and they become the osteoblasts. And then the cells that make the bone matrix, like I said earlier, are the osteoblasts. They are responsible for bone formation. They make the bone matrix, which consists of the collagen, the phosphate, and calcium. So they basically mineralize the bone. The osteoclasts are the bone macrophages. They dissolve the bone matrix. When the bone matrix dissolves, it's called bone resorption. And this actually causes the blood calcium and phosphate levels to increase. So whenever the body needs calcium, the osteoclast activity increases, which dissolves the bone matrix, and it allows more calcium in the blood whenever your body needs it. Okay, the osteocytes are the osteoblasts that are buried in the bone matrix. They maintain the bone. Okay, so let's talk about some of the functions of the bones. They support, they provide support for the body. They protect organs, for example, like the thoracic cage, which is made up of the ribs and the sternum and all these bones that protect the heart and the lungs. So they protect the inner organs. And like I mentioned, they provide a reservoir, a storage space for calcium and phosphate. For example, the bone matrix. So whenever your body needs calcium, the osteoclast activity increases. It dissolves the bone matrix, and it allows calcium to be more available in the blood. They also act as levers on which muscles act. So you have the bone, and then on top of the bone you have muscle. The muscle contracts and acts on the bone to move the bone, basically. And they also contain blood-producing cells. So over here we have two types of bone. We have compact bone on the outside, and then on the inside we have something called spongy bone. And then in between there are spaces where there is red bone marrow. This red bone marrow contains bone marrow cells which produce blood. So the bones are also very important for producing your blood, basically. Okay, so bones, like I said, they are vascular and innervated, of course, which is opposite to the cartilage, which is avascular. They have few sensory nerves. However, they are covered by an external membrane. So here's a bone. They're covered by external membrane called the periosteum. The periosteum has a lot of sensory nerves, and it's sensitive to damage. So like I said, they're covered externally by a fibrous connective tissue membrane called the periosteum, and we'll talk about it later as well. So the two types of bones, which I already mentioned, we have compact bone on the outside, and then we have spongy bone at the two ends of long bones. So here and here at the two ends, there's spongy bone from the inside. The compact bone is basically dense bone that's on the outside. It surrounds the spongy bone. And then the spongy bone, which also has other names like cancellous bone or trabecular bone, it's basically spicules or spikes of bone that enclose cavities or spaces containing blood-forming cells called the marrow. And it's found at the ends of long bones. So just to repeat what I said. Right here, the spongy bone or the cancellous bone or the trabecular bone, it consists of spicules of bone. So these little spikes of bones that you see, there are spaces between them or cavities. This is where the red bone marrow is, and this is where bone marrow cells produce the blood. Okay. Okay, so let's talk about anatomy of long bones. So first of all, the ends of the long bones are called the epiphysis or the epiphyses. Okay, and then the long shaft is called the diaphysis or the shaft. And then we also have at the epiphyses, we have cartilage covering the surfaces called hyaline cartilage or articular cartilage, right here. And at the ends of the long bones in the epiphyses, there's spongy bone. And in the spaces, there's red bone marrow, like I mentioned earlier, which are responsible for producing blood. We also have a membrane that's covering the bone, especially along the diaphysis or the shaft, called the periosteum. And this is important for bone growth. We'll talk about it later. On the outside, there is compact bone. And we also, right here in the middle, in the diaphysis, there is something called the medullary cavity. So this entire area here is called the medullary cavity. It contains yellow marrow, which is responsible for fat storage. Okay, and then something that lines the medullary cavity is called the endosteum, and it's important for the repair of the bones and remodeling. For example, if your bone breaks and so on. And then another feature of long bones is the epiphyseal plates or the growth plates. So here, and they're usually present before you hit puberty, but when you become an adult, they close. Okay, so let's talk about the periosteum. It has a unique capability of forming new bone. The periosteum is actually the site where the osteoblasts are located. So the osteoblasts are located here, and it forms new bones. Why? Because the osteoblasts are the cells responsible for producing the bone matrix, which gives the bone its toughness and hardness. So bone with no periosteum can't survive because that's where the osteoblasts are located. And unlike the bone, the periosteum is supplied with numerous sensory nerve fibers, so it's very sensitive to any type of injury. Okay, let's talk about embryonic bone development. Okay, let's talk about embryonic bone development. So in embryology, the bones develop via two ways. First, membraneous ossification, and the second way is endochondral ossification. Ossification just means that osteoblasts make the bone matrix, which gives the hardness of the bone, like I mentioned earlier. Okay, so membranous ossification is when the bone is formed directly from connective tissue without cartilage. So, for example, bones that develop by membranous ossification include the cranium or the skull, the facial bones, and the clavicles. And then we have something called endochondral ossification. This is when chondrocytes or cartilage cells make a cartilaginous model, which is then replaced by bone. So the cartilage is then replaced by bone. We call this endochondral ossification. And some examples of long bones that develop in this way include the long bones, like the humerus, the femur, the radius, the ulna, also the vertebrae and the pelvis, and the base of the skull. Okay, so let's talk about classification of bones. They're classified by shape. It includes long bones, short bones, flat bones, irregular bones, sesamoid bones, and we'll talk about each one. So long bones, they're bones of the limbs, so like the arms and the legs. For example, you have here the humerus, we have here the femur. These are examples of long bones. You also have the tibia, the fibula, the radius and ulna. These are all examples of long bones. Short bones, they are cuboidal in shape, and examples of short bones are bones of the wrist, so here, the carpals, and bones of the ankles called the tarsals. Flat bones consist of two compact bones and then a spongy bone in between. So these are called flat bones. An example of this include the skull, the sternum, the scapula, and the ribs. Irregular bones are bones of various shapes. For example, bones of the face, bones of the vertebrae, basically the spine, and the sacrum. And also the hip bones, the pelvis. Sesamoid bones are round oval bones that develop in tendons. So here we have the quadriceps muscle, and this is its tendon, which attaches to the tibia. And then here in the tendon is a bone called the patella, the kneecap. And there's also small sesamoid bones that are found in the hands and the feet. For example, this right here. So the skull is made up of facial bones here, and it's made up of the cranium. The cranium has two components: the calvaria or the cranial vault, and the cranial base right here. So let's talk about special senses. What are special senses? They're senses that are specific to a particular part of the body. So, for example, you can only see through your eyes, so vision is a special sense. What are some other examples? You can only smell by your nose, so smell is a special sense. Another example is taste. You can only taste by your tongue. So specific parts of the body with specific senses, that are only elicited by specific parts of the body, we call these special senses. An example of something that's not a special sense, for example, is touch, because you can feel touch everywhere. So touch would not be special sense. Okay, so the cranium contains the brain and special sense organs. For example, the organ of Corti located in the inner ear. So here we have the external ear, and then here in the middle we have the middle ear. And then in the inner ear, we have two structures, the cochlea, which is responsible for hearing, and the vestibule, which is important in balance. So in the cochlea, here, this structure here, the cochlea, in the cochlea, there's something called the organ of Corti, and it's very important for hearing. The facial bones has cavities for special sense organs. For example, the nasal cavity. Nasal cavity has the olfactory nerve, which is responsible for olfaction or smelling. The orbital cavity has the eyes, which are innervated by the optic nerve, and they carry the sense of vision, so seeing objects and so on. And then in the oral cavity, you have the tongue, which is responsible, which has sensory nerves that carry gestation or tasting. Okay, so the skull is a very complex structure. All of the bones of the skull are joined together by sutures. They are fibrous joints that are immovable, and we'll talk about the types of joints in the articular lectures in the future. So these bones of the skull are connected by sutures, except for the mandible. The mandible is the only bone in the skull that has the ability to move, that's mobile. The mandible is also the jawbone. It's the bone right here in green. This is the mandible. So let's talk about the base of the skull. The base of the skull has depressions called fossae. We have the anterior cranial fossa right here, and then we have the middle cranial fossa here, and we have the posterior cranial fossa here, and each of them have different structures you'll learn about in the future. So let's talk about some bones of the skull. We have the frontal bone, the parietal bone, the temporal bone, the occipital bone, the sphenoid bone, the ethmoid bone, the mandible, the zygomatic bone, the maxillary bone, and we'll talk about each in the upcoming slides. So over here we have the frontal bone, and we have the parietal bone, which is paired. It's a paired structure, that means there's two of it. We also have the temporal bone, which is also paired. The occipital bone, which is unpaired. And we have a complex bone called the sphenoid bone. It's basically right here. You can see it from many angles. So from the lateral surface or the lateral view, it's right here. From below, it's the structure in red over here. There's the sphenoid bone. And then it's also a bone that forms part of the cranial base. So all this right here is called the sphenoid bone. And in the orbital cavity, you can also see it. It's right here. Okay, so this is the sphenoid bone. And then another complex bone is the ethmoid bone. From the cranial base, it forms this part. Okay, this is a superior view. And medial to the orbital cavity, so right here is the orbital cavity. Medial to it, you can see this is the ethmoid bone from the inside. So from the outside, it's not really that visible, but it's right here. And this is the nasal cavity, by the way. This is the nasal cavity, this is the orbital cavity. In the middle, you have the ethmoid bone. And also in the orbital cavity, you can see it right here. This right here, the white color is also the ethmoid bone. Okay, let's talk about the mandible. Right here we have the ramus, and then we have the angle of the mandible, and we have the body of the mandible, and then we have an area where there is the prominent chin called the mental protuberance. Okay, so the cheekbone right here is called the zygomatic bone. Right here, the upper jaw is called the maxilla, structure in yellow. Let's talk about some skull cavities. We have the cranial cavity, the orbital cavity, the nasal cavity, the paranasal sinuses, the middle and inner ear cavities, and the oral cavity. The cranial cavity is the largest skull cavity. It houses the brain. The entire thing is the cranial cavity. Orbital cavity, we talked about it before. It houses the eyeballs. Nasal cavity, this here is the nasal cavity. You have the olfactory nerve here, which senses smell. The paranasal sinuses are hollow spaces in the bones of the skull, and there are 4 paranasal sinuses that are paired. They're paired structures. They consist of these 4: the ethmoidal air cells, the frontal sinus, the sphenoidal sinus, and the maxillary sinus, and they're named according to bone in which they are found. And they all communicate with the nasal cavity. So for example, here in the frontal bone, we have a space called the frontal sinus, and it's also here. And then in the maxillary bone, we have the maxillary sinus. It's also here on this side. And then in the sphenoidal bone, so this entire thing is the sphenoidal bone, we have the sphenoidal sinus. It's also present here. And then medial to the orbital cavity, in the ethmoid bone, we have the ethmoid air cells. They're also present on the other side. So here we have the outer ear, and then we have some cavities in the ear. So for example, here we have the middle ear cavity, and then we have the inner ear cavity, which contains the cochlea, responsible for hearing, and the vestibule, which is important in balance. Oral cavity, basically your mouth, contains the tongue and your teeth and so on. Okay, let's talk about something called fontanelles. The fontanelles are soft spots in the baby's head. It's made up of fibrous connective tissue. So all these things right here are the fontanelles. For example, here we have the anterior fontanelle. Here's the posterior fontanelle. So all these spaces here are the fontanelles, and they are important to enable the skull to be more flexible during childbirth. Because as you can see, the baby's head is very big and the birth canal is relatively small. So the bones of the calvaria, or the fetal bones over here in the cranium, they need to be able to move so that delivery can be possible, basically. And usually after delivery, the baby's head develops a temporary deformation called molding, where there is a cone-shaped head. And also another important function of these fontanelles is that they allow the developing brain to stretch the skull, because the baby's brain is going to be developing very fast relative to the development of the skull bones. So the fontanelles allow the skull to stretch when the brain is developing fast. So each of these fontanelles close eventually. So that means they ossify, they become bone. And for example, the anterior fontanelle, right here, this is the anterior fontanelle here and here. It closes 18 months after delivery, and it's the last one to fuse. And for example, you also have the posterior fontanelle, which closes earlier. It usually closes at birth or up to 2 months. And in total, there are 6 fontanelles.